iUnderstand.
Transgender people are people who experience a mismatch between their gender identity and their assigned sex. Transgender people are sometimes called transsexual if they desire medical assistance to transition from one sex to another. Transgender is also an umbrella term. It may include people who are not exclusively masculine or feminine, people who are genderqueer, for example, bigender, pangender, genderfluid, or agender. There's also third gender or cross-dressers. Being transgender is independent of sexual orientation. So transgender people may identify as heterosexual, homosexual, bisexual, asexual, etc. Or they may consider conventional sexual orientation labels inadequate or inapplicable. The term transgender can also be distinguished from intersex. Intersex is a term that describes people born with physical sex characteristics that do not fit the typical description of male or female bodies. The degree to which individuals feel genuine, authentic, and comfortable within their external appearance and accept their genuine identity is called transgender congruence. Many transgender people experience gender dysphoria. Gender dysphoria is the medical term that is used to describe people who experience significant distress with the sex and gender they were assigned at birth. Some people with gender dysphoria seek medical treatments such as hormone replacement therapy, sex reassignment surgery, or psychotherapy, but not all transgender people desire these treatments, and some cannot undergo them for financial, medical, or cultural reasons. Transgender people face discrimination and unfair treatment in many cultures and situations. So let's talk about intersex. As an introduction, let's discuss some embryology. Embryology is a science that studies development of embryos and fetuses in the womb. The external genitalia of males and females are undifferentiated at 4 and 6 weeks of pregnancy, and then start to differentiate at 10 weeks for males and 20 weeks for females. The final results are the external genitalia at birth. It is important to realize that the same initial tissue makes up different structures in males and females. Some people have different circumstances that prevent them from developing along the same path that others do. The results of these developments may be intersex individuals. Intersex individuals have sex characteristics of both males and females. Intersex is a general term used for a variety of conditions in which a person is born with a reproductive or sexual anatomy that does not seem to fit the typical definition of male and female. Let's have a look at some illustrations by Dr. Frank Netter. A person might be born appearing to be female on the outside, but having mostly male typical anatomy on the inside. Or a person may be born with genitals that seem to be in between the usual male and female types. For example, a girl may be born with a noticeably large clitoris, or lacking a vaginal opening. Or a boy may be born with a notably small penis, or with a scrotum that is divided so that it has formed more like labia. Or a person may be born with mosaic genetics, so that some of her cells have XX chromosomes and some of them have XY. Though we speak of intersex as an inborn condition, intersex anatomy does not always show up at birth. Sometimes a person isn't found to have intersex anatomy until they reach the age of puberty, or find themselves infertile adults, or die of old age and are autopsied. Some people live and die with intersex anatomy without anyone, including themselves, ever knowing. So which variations of sexual anatomy count as intersex? In practice, different people have different answers to that question. Imagine the sex spectrum as the color spectrum. There are different wavelengths that translate into colors most of us see as red, blue, orange, yellow, and colors in between. In the same way, nature presents us with sex anatomy spectrum. So breasts, penises, clitorises, scrotum, labia, gonads, all of these vary in size and shape. Nature does not decide where the category of male, intersex, and female begin and end. Humans decide. In fact, there is evidence that children who grew up with intersex genitals do well psychologically. In other words, these surgeries happening before the age of assent or consent are unnecessary. Parents often ask for these operations because they fear discrimination against their children. The best way to be a better human is to learn something new about science every day. If we all accept each other with all our differences, the world will be a much better place. Wishing you the best of health. This video contains general information about medical conditions. The content might not be suitable for everyone and should not be treated as such. Always consult your doctor before using medications. The medical information is provided without any warranties or legal obligations to those who might apply them.